Good afternoon, bonjour. Last week, our province heard the heartbreaking story of the death of 16-year-old Lexi Daken. This past week, thousands of New Brunswickers shared the social media story of the tragic loss of life of a beautiful young woman. And we shared the despondency and grief with those who loved her. Earlier today, I had a conversation with Mr. Daken, and we will be meeting with the family very soon. They are hurting beyond words, but determined to make a difference. Earlier this week, I issued a statement that we must fix our broken system. I mean it. While the Health Quality and Patient Safety Act defines a process for the review that will take place, and I can advise that Horizon is following that process, I want to convey that I have not waited to take action on calling for improvement to services for mental health. That means in the ERs as well as in our communities. Yesterday, I spoke with Horizon Health Network senior officials to discuss how we can address crisis care in our emergency rooms and have asked them to report back to me by the end of the month. A similar conversation will take place in due course with Vitalite Health Network. And on Monday and today, I spoke with Norman Bosse, New Brunswick's child, youth, and senior advocate, to talk about a review of services for mental health crisis care. More details will follow on that. Lexi's parents have done something very brave. They have shared their anguish publicly, and we cannot let that be in vain. We know there are many studies and reviews on similar situations. As I have indicated, I want to continue to improve mental health services in New Brunswick. The Interdepartmental Addictions and Mental Health 5-Year Action Plan is a solid foundation on which to build. The step care model we introduced is meant to provide the appropriate services to those in need, when and where they need them. Most importantly, the principle of continued improvement and continued engagement will be followed as we implement the plan, and we will immediately take action to put better crisis care services in place. I want to express my sincere sympathies to Lexi's family, friends, and all who loved her, and to all families that have walked this path. Merci. Thank you.
Merci beaucoup, Minister. Thank you, Minister. Kevin Bissett, Canadian Press.
Minister, you talked about review and putting things in place. Does this go as far as being called an inquiry, as what David Kuhn has been asking for?
This is a review.
Why not an inquiry?
A review is done in many of past cases and this case. Norm Bosse has the independence of his legislative office. He has a mandate to provide this service, and when we can't get this independent body in other areas of government, then we need then we go outside. But in this case, we have the Child and Youth Advocate here, and he has a legislative mandate to do this.
Thank you. Adam Bowie, Daily Gleaner.
Minister, I know that you've asked the health authorities to report back to you by the end of the month. What do you expect to hear from them about what they can change and how concrete action can be taken to address, access in the ER rooms?
Well, I realize that that lots of professionals have input on how these services are carried through, and the RHAs need to have those conversations with them. However, my department and the team at the Department of Health is also already beginning reassessing work that we have done even up to our previous engagements that we've had with stakeholders in the community to develop crisis care clinics. And it would sort of to be an evolution of the walk-in clinics, but we will step that up, and we will have some identifying factors from our own department. I don't want to presume what I'm going to receive from the RHAs. I've just asked them to be to make sure it was meaningful and that we get it rapidly.
Do you think some of those those walk-in clinics could be made available earlier than expected?
There has been a tremendous amount of enthusiasm to get them done on the heels of the Campbellton demonstration model. So I believe that that will be the direction we go in. But I say that in hesitance because I don't want to assume. I don't want to preempt their work. It is important that they come back to me with resolutions, and it's important that I be a critical thinker when they come forward and be very diligent in asking the questions I need to ask to be assured that we're going forward in a right direction.
Silas Brown, Global TV.
Hi, Minister. I just have a quick question on vaccines, specifically with the arrival of the AstraZeneca vaccine in the country today. I'm curious, with that vaccine being recommended to be only used with people 65 and under, how does this change the province's vaccination rollout plan? Are we going to see adjustments to that and potentially new priority levels, or will this vaccine be able to be used for people who are currently in the top priority levels?
So as we've said before, as the information becomes available, our staff at Public Health are and with the Vaccine Rollout Task Force are constantly assessing. They will bring forward any suggestions of changes to the COVID Cabinet Committee and to Cabinet, and we'll make those decisions in due course.
Justin Dupuis, L'Acadie Nouvelle.
Hi, Minister. Radio-Canada quoted Dr. Louis Thériault this morning saying that there is the province is missing about 20 psychiatrists and 30 workers in mental health clinics. Are there any plans to fill this gap?
We are always working on recruitment of many major medical professional positions, and psychiatrists are included in that. So yes, we will continue to work on recruiting of psychiatrists, but as I've explained before with the Mental Health and Addictions Action Plan, we're going to make sure that we utilize all the resources that we have. And so, that includes psychologists, that includes, we have wonderful guidance counselors, that includes, we have licensed clinical therapists around this province, and we're working on a mechanism so that we can utilize their services. So we need to look at this for the whole system that it is, knowing that if we can help people with lower acuity, we save our specialists for those who have higher needs. And so it will be a multifaceted approach.
Marie Sutherland, CBC.
Good afternoon. Minister, I spoke with Chris Daken yesterday, and he did say that he would support a public inquiry, which, as you know, David Kuhn has also called for. Will you be calling a public inquiry into the handling of suicidal youth in the province's ERs after Lexi's death?
So what I have stated is that we will ask Norman Basse, the child and youth advocate, the child, youth, and senior advocate in this province, to review services for mental health crisis care. The scope of that has not yet been defined. And so I think you can appreciate that it is early days, but we are, I spoke with him on Monday, I spoke with him again today, and we will work towards, getting this launched in a very quick manner.
Michel Corriveau, Radio-Canada.
Hi, Minister. It looks like many psychologists and psychiatrists are in the private sector because they have more money there. So I'm wondering, is the province ready to pay them more to recruit more psychologists and psychiatrists? And also, do you think there will be more money in the next budget for an improvement in the mental health?
So we have spoken about increases in the mental health budget, and they're still being analyzed. We as we've tabled the 5-year mental health and addictions plan, I think you can appreciate that there was momentum for moving forward with mental health initiatives. We have a lot of community partners who are willing to participate in that process. And so as we progress, I believe there will be meaningful investment, and we are going to we're going to do what I said we'd do, which is to improve mental health access services in this province.
Laura Brown, CTV.
Hi, Minister. I understand that it might be early days for that review, but it's certainly not early days for families who are going through this. And so they have a lot of questions, and we have a lot of questions, and mental health advocates have a lot of questions about why things were not done before now. And I think one of the main ones, and something that has been brought up a couple of times that advocates say could happen today, is that a psychiatrist could be on call 24/7 at the ER in some of the main centers. I'm wondering where you're at with that question.
So, Laura, I've given the RHAs a directive to decide and to bring to me ways that we can improve this service, and they have to the end of the month to do that. It was a determined directive. I believe they will follow it, and I believe that I will have that information by the end of the month. And do I disagree that psychiatrists should be on call? Nope, I don't. And so we have to figure out how we can get there.
We have time. Alison Roy, l'Acadie Nouvelle. Travis Fortnum, Global.
So it sounds like we do expect to see some change come from this review, but in the meantime, what advice would you offer to someone who is in a position like Lexi Daken was that day she went to the ER, someone who feels like they're not getting the help they need, who feels like they're at the end of their rope?
So right now, until we have the establishment of crisis care clinics, or however that looks when it comes back to us, the ER is where we really have to direct for crisis. However, we have implemented a number of virtual services, and I can only ask that as we are moving through this process, I think that I can share with you that I was invited to the mental health table in December of 2019. I've taken it very seriously, and we're trying to move forward with meaningful change. And I will implement it as quickly as I can. I know that Lexi's family are not the only ones that have left a hospital feeling frustrated, hopeless. It is, it is heartbreaking, and we're going to do everything we can to improve that. And I believe that all staff who are trying to provide the very best they can are going to be diligent in the short term to the needs.
On a le temps pour faire un autre tour des questions. We have a bit of time to do another round of quick questions. Kevin Bissett. Savannah Odd, did you join?
Yep, I'm here.
Do you have a question?
Hi, Minister. One of the action items on the mental health plan involves supportive housing. Community groups working with housing insecure folks who have addictions or mental illnesses have mentioned they're worried about the lack of concrete timelines right now about when these units will be ready. I'm wondering if any of them will be coming this year through the units already approved in the bilateral agreement I guess, allotment, or if you can offer any sense of your goals with implementing that particular step.
So I can't comment on the units that might be available this year, but what I can say is that equally as important as the housing unit are the wraparound services. And so we have been working closely with social development. And as my time with social development, I tried to work very closely with health in understanding what those wraparound services could look like. And so we can certainly ask that someone from social development get back to you on those units, but it is imperative that we continue to work with our community stakeholders who understand this need, and that we don't forget that the wraparound services are equally important as that housing unit.
Thank you, Savannah. Adam Bowie?
Minister, we're hearing from some advocates who say that cash needs to flow in order to make significant changes. Is that your understanding as well, that investment is one of the ways this will be resolved?
Well, I think if we're going to invest, it has to be the right investment, and I've made it very clear that I'm not willing to make change for the sake of change. And I've also made it very clear that in tabling the 5-year Mental Health and Addictions Action Plan, that the work we do must be meaningful and it must be relevant to communities. And every community will be slightly different in their needs. So investment, yes, and then we need to assure that that investment's going in the right place.
And will we see that in this month's budget?
Yes, I believe you will.
Silas Brown?
I'm okay.
Yes, you are. Thank you. Justin Dupuis, l'Acadie Nouvelle.
C'est tout, merci.
Merci beaucoup. Marie Sutherland, CBC.
Yes, so we know Horizon's doing an internal review of what happened in Lexi's 8-hour wait in the ER. Will the public be able to hear the results of this internal review?
That's the reason that I have spoken with Minister Bossé, because the review with Horizon is internal. It will be shared with the family, and it will be shared with the Board of Directors of Horizon, and I'm trying to think if it will be shared with someone else, but off the top of my head, that's the direction of, and that's the process for that review as it's defined under the Act. And that's why I placed a call with Mr. Bossé on Monday to have a discussion about a review.
Laura Brown, CTV.
I'm wondering if anyone from Horizon, if you can tell us if anybody from Horizon is currently off work because of this situation.
I cannot answer that question today.
Thank you. Michel Corriveau.
Yes, Minister, I have a question on the compassionate visit. People who want to visit someone in the hospital and can go there. There is 2 cases reported by Radio-Canada where some ladies were not allowed and their father died in the hospital all alone. So is there any provision or anything you could do to prevent those tragic incidents?
That is heartbreaking, and I do know that the RHAs we've been working with them, and I thought as of last week those opportunities for visitation were more relaxed. So we will take that back to the RHAs and ask about it. It's apparently during business hours, and the Red Cross can certainly help facilitate some of that as well. So thank you for bringing that to my attention, and we will make an inquiry.
Travis Fortnum.
Thanks, I'm good.
Sure. Alexander Silberman.
Thank you, Bruce. Minister Shephard, I'd also like to follow up on a couple of the situations we've heard about recently. I know you can't speak to specifics, but there was a woman in the Edmonton area who couldn't see her dying father because of delays in getting access to the hospital. So I'm wondering, do you believe additional changes need to be implemented to prevent delays in hospital visitations in these end-of-life situations? And if so, when can some modifications be expected?
Well, I'm very sorry to hear that. And we can work with the RHAs to see what those hurdles are. I'm not aware of the situation you spoke of, but I will say that even with individual nursing homes, we've had to give them some ability to control who was coming and going because of individual home circumstances. That could be staffing. It could be, because of any sickness that might be happening within the nursing home. With our COVID restrictions, we've been able to move through some of that with vaccination. So as this progresses, I'm sure there will be more changes. But certainly when we have individual circumstances that are dire, I think that we would like to help in any way we can.
Thank you, Alexander. Savannah Odd, do you have another question?
I do. Thank you, Bruce. Just again on the mental health plan, I know part of that plan is to, bolster resources in anticipation of COVID-related, stress or maybe spike in mental illness. How, specifically does the department plan to do that? I know the nurse practitioner plan, we had hoped to fill, I think it was 30, and we've only seen 17 over the past year. So I know we've struggled, with even that. So given these resource constraints that already exist, what else is the department doing to fulfill that part of the plan?
So I mentioned this before, thank you for the question, that we have approximately 400 licensed counseling therapists around this province who practice in the private sector. And they speak both official languages. They are a tremendously trained professional. And so they have been working through a process. I don't want to speak for them, but they have been working through a process to achieve a bargaining agent and then to working with Treasury Board so that we can bring them online as a resource. And I'm sure we're going to, I've certainly made that inquiry since last week to see where that process is, and we've been trying to stay on top of it. It is moving forward. But that's a resource that we haven't utilized within the Department of Health up till now, and I believe it will give us a boost to our services.
Merci beaucoup. Thank you very much, everybody. That concludes this availability. Merci beaucoup à tout le monde. Thank you.
Merci, bonne journée.